Hello, I'm Brittany. I'm going to be teaching you how to take care of your teeth today. What is your knowledge right now on how a cavity is formed or biofilm?
You eat candy and you get cavities.
Well, pretty close. That is one thing that can cause them. But so first, it actually starts with acquired pellicle. And what that is it's formed of glycoproteins and it forms on all the surfaces of your teeth. On restorations, on calculus that's already there, or on your actual tooth, and on any of your soft tissue. And so it's good and it's bad. So it can protect you against acids in your mouth, and it keeps the mouth moist, but it also allows biofilm to adhere to it. So it can trap microorganisms, and then what those microorganisms do is they feast on any fermentable carb that you eat. So sugar, like you had said, in candy, or any bread, crackers, cooked starch. It will take those and metabolize them and turn it into acid. So the more frequently you eat carbs and like small amounts snacking throughout the day, the more frequently the acid is produced. And what the acid does is it enters the tooth and the enamel through little diffusion channels, and it starts breaking down from the inside out. So if you see any little white spots on your teeth, that's demineralization. But good news, we can remineralize that with the use of fluoride. So you can have dental treatments done with fluoride, or there's also fluoride in some toothpaste or mouth rinses, and the fluoride will enter the tooth with the acid, and it will help reduce the breakdown of the enamel, and it will also inhibit some of the microorganisms in biofilm. Alright, so next we can take a look in your mouth and see how you're doing with oral hygiene right now. So it looks like we have a little bit of edema here in the front on the mandibular anterior facials, and it looks like a little bit of possible recession right in here. Okay. Put your bib on you here. We have a disclosing tablet that we're going to have you chew up and swish around your mouth, and then you can rinse it with a little bit of water. What that's going to do is it's going to show you areas you might not be doing so well in brushing, so where you have biofilm accumulating, and then I will show you how you can take care of that. Hold them here. You want to give me a big smile? Alright, looks like you're not doing terrible. We could do a little bit better interproximally in between your teeth, so we will definitely do some flossing to help that, and around your gingival margins. And I have a really good toothbrushing stroke that will help you with that. What you'll want to do is you'll take a nice long piece, maybe about as long as your forearm, and you'll roll it up on your middle fingers there, and you will have a little piece here, and then you'll roll the majority of it on the other side. So that way we can use a piece, and then once that's sturdy, we can just roll to where it's clean. So when you're doing your maxillary teeth, so your upper teeth, you will do thumbs up. So it'll look something like this. So you'll want to have one hand on the inside, one hand on the outside of the teeth, and you'll saw it up just like this, just till you're inside, and then you'll want to make a C shape. Do you see that there? So then you'll slide it on this tooth, and then make it the other way, and slide it right back there. And then, when you're doing your mandibular teeth or your lower teeth, you'll want to push down with your pointer fingers there. So it'll look like this. So you'll saw in between. Not too hard. You do it diagonally so you don't hit your gum too hard there. And then you'll do the same thing where you make your C shape there. Do it about 4 or 5 times on each side. And then you'll make the C shape on the other side. And what that C shape is going to do, it's going to make sure you get your caul area, so the gingival tissue right in between your teeth, which is the most susceptible part to gum disease. Would you like to give it a try?
Yeah, sure.
Nice long piece.
Forearm.
Perfect.
Got it. Middle
Middle
finger.
fingers, yep. Perfect. And then you'll go thumbs up. All right, got right in between, and then make sure you make that C shapes. Oh, there you go, perfect. And then do it right on the other way so you can get the distal side. Make sure you have one hand on the inside and one on the outside.
Mm.
And then get this hand a little bit more back so you can really have that C shape going. There you go. All right, good job. Can I see you do a mandibular teeth? Yep. And then make sure you really get that C shape. So, put 'em right there is perfect. And then you can do it the other way as well. And then go up and down. Yeah, just like that. Can you show me how you floss one of your posterior teeth?
Yep.
All right, make sure you get that saw in there. And then really do that C shape. Yeah, and up and down. Great, and then reverse it. Nice. And what about a mandibular posterior tooth? All right, so, yep, C shape. Very nice. Good work. All right, now we can move on to some brushing techniques. First, we'll start out with the sulcular technique, and this is gonna help you get right under your gingival margin, which is a place that's very susceptible to biofilm. So what you'll do is here right your gum line, your gingival margin, and then we'll tilt it 45 degrees and just vibrate, just like that. And then you want to do it maybe 10 times on each section, and then go to the next one, overlapping a little bit, just so you really make sure you got every area. And the way you want to hold your brush is you want your thumb on the bottom, just gripping it. So even a little bit higher than the grip they have is okay. So we'll do that on the bottom too. And the mandibulars, 45-degree angle there. And then you can do it on the linguals as well. So we'll be here, angle it, just right there. So you want to do all around the mouth. The only place that's a little bit tricky, you have to do a little different, is your anterior linguals. So if you want to open up for me and look in the mirror. So up top here, we'll have you brush with the heel of the brush, just like that. So a little vibrating all around, and then same down here. Vibrating just like that. Would you like to give it a try?
Sure.
Good angle there. Very nice. Can I see you do a little bit farther back, so a posterior teeth? A little bit more angle, so just in other way. There you go. Alright. And can you do the front like I showed you? The back of your front teeth? Very nice. And what about your lower teeth? Very nice. And can I see the lingual there as well? And what about the lingual of a posterior tooth? Very nice. So we're gonna start with the bottom of the brush right here with your incisal edge or your occlusal edge in the back. So you're just gonna start right there, and then you'll flick it down like this. So with a little bit of pressure, so you're getting all of that. You can see the pink coming off there. So we'll do it the same way, going around making sure we overlap. Same with down here, except we'll roll it up. Make sure you're brushing the teeth. And then same, the linguals. And up here as well. And then your front teeth are a little bit different again. So we start with it inside your mouth like we did before. And we'll just brush it through like that. This is the part that gets your mirror dirty a little bit. And then down here as well. Would you like to try?
Mm-hmm.
Feel it brushing your gingiva a little bit?
Yeah, it's getting the gingiva.
Mm-hmm. Alright, and can I see a lingual surface? A little tricky to get in there. Alright, and what about the front there? Yep. Very nice. Good job. And now I can teach you about brushing some of your soft tissue. So this would be your oral mucosa. So we have your buccal mucosa is what like your cheeks are, and then in the front it's your labial mucosa, and then up top would be your palate. So I'll show you how to brush all of those. So we're kind of going to use a similar stroke that we just did with the rolling stroke.
Mhm.
But if you want to open up, I'll show you. So on your cheek here, we'll just brush around right in there. A little tough, but not too tough that is gonna cause any lesions. Same with up here. This will tickle a little bit. Just brush maybe back and forth there. And then you can do the same like down here. Would you like to try that? Nice. Good job. More brushing stroke for you. So this is going to be for your occlusal surfaces, chewing surfaces of your posterior teeth. So what you're going to do is you're going to place it, can you see all right?
Mm-hmm.
You're going to place it right on top there, and you're just going to scrub back and forth there. Same with up here. Nice, scrub, scrub, scrub. And then you'll do that on all of the occlusal surfaces.
Right.
You can use a little bit more pressure there since you're not near your gingival tissue. Very nice. Looks good. And now I can show you how to take care of your tongue as well. So we have this cool little tongue scraper. Can I have you stick your tongue out for me, please? Alright. So what you'll do is you'll press down firmly and just pull down here. See all that came off there?
Mm-hmm.
And you'll want to do this on so the top and the sides of your tongue. Would you like to try?
Mm-hmm.
So you really got it good there. Good job. So the biofilm that we talked about and we talked about removing, it's so important to remove it because as it ages, it gets more dangerous and your body, it responds to it like it does a disease because it can lead to periodontal disease. And what that is your body attacking your tooth because it thinks that is what the disease is. So it sends out substances to destroy the fibers that are holding the tooth in, and this is what will cause recession and eventual bone loss. And then eventually, if it doesn't get any better, you don't get the proper treatment, the tooth can fall out, and then your body thinks the job is done because the disease is gone. So with the techniques we just talked about with the toothbrush, it's beneficial to have a soft toothbrush. That way you're not causing any more wear or tear to your teeth than you need to. You're just removing the biofilm. And it's also important to have nylon bristles. For you, I think you could have a small to medium-sized toothbrush. Medium would probably be the best, but small would be okay for getting your anterior teeth and linguals. And since biofilm removal is very important, you want to keep up with it, we recommend that you brush at least 2 times a day. Like a lot of people don't like to floss too much, so at least do 1. If you could squeeze 2 in, that would be great. And then use your tongue scraper at least once a day as well. You learned about biofilm today.
I learned I can get cavities from any carbs, not just candy. And by using the proper brush strokes, I can learn how to get this biofilm off of my teeth to prevent cavities.
Yeah, and how many times should you brush a day and floss?
I should brush 2 times a day and floss 2 times a day, but sometimes 1 time a day.
Hopefully 2.